Thank you for listening to Pierce Clinic Stories, where we hear stories of how patients of the Pierce Clinic in St. Petersburg, Florida, have been helped with various conditions. And today I'm talking with Dr. Stan Pierce, who is an upper cervical chiropractor at the Pierce Clinic. And today he is going to tell us about a lady who suffered with migraines and how she was helped when she had an upper cervical correction. Hello, Dr. Pierce.
Hello, Dr. Hambrick. Yeah, there was this really sweet girl named Jill that had been recommended to our office by her mother, who was actually a hospice nurse at the local hospice center. And her daughter was suffering with really devastating migraines. And for anybody that suffers with migraines, you know how disabling it is. I mean, you can't focus, you can't. And she didn't want to open her eyes. She didn't want to get out of bed. All the blinds in her room were always kept closed. Her mom had the toughest time to get her to eat because she would just want to throw up all the food she would eat. So it was really frustrating for her. Her mom had set her up the appointment with us, but she missed her first appointment, just skipped it, didn't want to get out of bed. She was gaining tons of weight, laying around all the time. Tons of weight, that sounds horrible. But anyway, she was getting overweight. And so her mom set her up a second appointment. She missed that one too. Her mom sets her up a third appointment. She skips that one too. And by this point I'm thinking, I want to get this girl in here. I really want to help her, but she obviously doesn't want, she can't bring herself to go to another doctor. And I spoke to her mom, and her mom said she doesn't trust doctors, that she's been to too many. Nobody's figuring anything out. And they're just trying to medicate her, so she was frustrated. So she finally got her in. And what happened was, when I was talking to this girl in the consultation, she had been told that her migraine was due to something called a pseudo tumor, which was a fluid-filling tumor inside her head. And the pressure was in that tumor area was just causing her to have such an intracranial pressure, an internal head pressure, that the migraines were inevitable. There really wasn't a whole lot they could do. They told her we could do a shunt. We could stick a needle into your head, into this fluid-filled pocket, and suck the fluid out. But it's kind of a dangerous procedure, and even if we are successful, the fluid is going to be building back up. And this is something they clinically see. So she was frustrated and thought, how is some chiropractor going to be able to help me? So that's why she kept missing her appointments. So the girl comes in, we're talking, and she's just miserable. She just looks miserable. My heart was just breaking just thinking this young girl. She was like 21 at the time. Just so frustrated and suffering. So we get the girl examined, and in the examination we were just doing some gentle muscle testing, posture evaluations. We found obvious evidence of a misaligned vertebrae in the upper neck because the nervous system wasn't functioning from that point down. Wasn't functioning very well at all. She had a compromise of strength in her arms, her back was twisting, her nerve in her neck was inflamed, muscle spasms. And once we identified not only what the problem was, but the exact location, we then proceeded to take x-rays from 3 different dimensions on her neck. And we had her come back the following day so that she could see the x-rays and what we had found. And we had found that her top vertebrae in her neck had gotten misaligned from a trauma that we were actually able to identify had occurred about 10 years ago. And her headaches had been building ever since. So the girl was still pretty much in disbelief because doctors had told her things before that they thought this would help or that would help. But all I was doing was showing her the facts. I wasn't asking her to believe in anything. I just said, here's the facts. This is what your x-rays are showing. Here's the misalignments. You have your top vertebrae misaligned to the side and rotated. Your second one's misaligning in a rotational direction opposite of the top one. It's creating a difficulty on your blood supply to your head. It's creating a restriction on the flow of nerve supply down your spinal cord and the cerebrospinal fluid. And this is very likely the cause of your migraines. She, at that point, basically said, look, I got nothing else to lose, so why not? But she did not believe at all that we were going to be able to help her. She just thought, my mom's fussing at me enough, I'll do it. So we take the girl into the adjusting room, and we have her lay gently on her side to receive the correction. And we put her coordinates, the mathematical coordinates we obtained from measuring her x-rays, we plugged those math coordinates into the ingesting instrument, and we sent a single sound impulse, a percussive sound wave, into her bone structure on her exact coordinates. All she heard was a little dink. She didn't feel anything. She was just laying there. She heard a little dink. And I brought the instrument away from her, and she's laying on her side, and she says, "Why are you whistling?" I said, What do you mean?" She goes, "Are you whistling?" I said, "No, I'm not whistling at all." "Are you hearing a whistle?" She said, "Some high-pitched whistle, yeah." So it's not me. So we sat her up, and as she sat up, she starts going, "Ugh, what's that? Ugh." I'm like, "What's wrong?" And she said, I got this horrible taste, some taste in the back of my mouth. Ugh. And she said, "I'm swallowing this fluid, but it's nasty." So we proceeded to do the follow-up check of her nervous system, and she was showing incredible signs of nerve release right there, signs that I could see and signs that she could tell as well. We then took her down to the x-ray room, re-x-rayed her, of course, to remeasure and make sure the bone structure all lined up properly, and she had lined up very well. Shortly thereafter, her migraines began resolving. Very shortly thereafter, within just a few days. She ended up not laying in bed anymore. She ended up opening the blinds of her room. She ended up taking up tennis again. Within just a few years, she moved out west to go to school because her life was coming back. She ended up getting engaged. I just met her husband recently. Her whole life came back because her mom knew something her daughter could benefit from and thought, why not? What could it hurt to just go down for an evaluation and see if they could help her? And I'm glad the daughter took the opportunity to do it. Jill's been doing so much better, and it's a great story. And what we were able to rationalize with the thing she noticed after the adjustment was, if you've ever had something of high pressure, like a tea kettle on a stove, and that pressure builds up too much, it releases this high-pitched squeal. So all we could rationalize was, once we'd gotten her corrected, somehow that opened up the flow of cerebrospinal fluid, this fluid around the brain and spinal cord, and the pressure began releasing. And the fluid began draining, and some of the fluid might have been draining down the eustachian tube connection somehow, because she was tasting it almost like what that would taste like when you were draining eustachian tubes. So it was a very cool story. I'm not 100% sure on if that's why those symptoms came after the adjustment, but she just did wonderful. No more headaches, no more disabilities. Got her bachelor's degree, got married. So life's good.
Can you tell us a little bit about what it is that you look for to determine if a person has an atlas misalignment? What are some of the indicators that you use?
Well, in the examination room, we will evaluate muscle balance, because nerves control muscles. So we will have a patient lie on their back and lay in a nice straight fashion on a table, and we will look to see if there's any evidence that their spine has a twisting occurring to it. So we'll go down and evaluate by looking at the feet, taking in consideration abnormal shoes or any possible genetic anomalies in the length of their legs. And then we'll go up and we'll feel the lower back muscles while they're laying on their back and determine if there's any spasm occurring on one side or the other. If the back is spasming one-sided only, that's not a stress situation. That's a stimulation problem where the nerves are overstimulating the muscles. If that's occurring, then we go up and strength test the arms. So now we've tested for a spasm balance issue, and now we're testing to see if there's equality of strength from arm to arm. Now, we all know that the dominant arm usually is a slight bit stronger than the non-dominant arm. However, we almost always will find that if a patient's upper neck is out of alignment, they will have an obvious weakness occurring. Often it's in the dominant arm, which surprises the patient, but then we have them turn their head to the left and retest it, turn it to the right and retest it, and we will see strength changes occurring very quickly. As well as spasms in the low back will release very quickly once we have had them move their upper neck around. And that indicates to us there's a nerve interference occurring from some type of misaligned bone in the neck. That gives us an indication to check into that further. That's where we take the x-rays.
Okay. So the x-rays, they don't they don't tell you there's a misalignment. They tell you what to do after you know there's a misalignment. Is that right?
Correct. We've already got evidence of the person not functioning right. When we leave the examination room, we already know there's a misalignment, and the way we examine a patient, they know it too. We don't ever have to try to convince a patient of something. That's not part of our protocol. The way that we examine them, they can tell just like we can. And they're excited. By the time they leave the exam room, they realize we can help them. So what the x-rays do is the x-rays are taking a snapshot of a moment in time where we're seeing where that bone structure is positioned at that moment. And we measure those x-rays to analyze a patient's genetic structural position as well as misalignment position away from their genetic normal. And we calculate the exact coordinates for correcting that patient's misalignments. And then that's what we take into the adjusting room to correct the patient with.
All right. Well, thank you very much, Dr. Pierce. Very good story. We'll talk to you later.
My pleasure. Thank you.